McGilvray.
Here.
Jackson.
Here.
Nelson.
Here.
Cavell is running late. Gingell.
Here.
Kuhn.
Here.
Lubes.
Here.
We have a quorum.
Thank you. Please join me in standing for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Our first item on the agenda is approval of the minutes from January 11th. I have a motion by Commissioner Gingell, support from Commissioner McGilvray. All in favor say aye.
Aye.
Opposed? All right, the minutes are approved. And the next item is approval of the agenda. I have a motion by Commissioner McGilvray, support from Commissioner Hoffman. All in favor say aye.
Aye.
Opposed? All right, our agenda is approved. Our next item is public comment. Is there anyone from the public wishing to comment on items on the agenda? Oh, welcome.
Hi. Tasha Shergan from Clarkston. I want to touch base on two items on the agenda, 9A, the Blueprint for Successful Aging. So this blueprint is based on a California program, which is very invasive and costly. I also want to point out that there should be no vaccination requirements for seniors. It should not be promoted. That's the family's right to choose. And for 9B, excuse me. So the sheriff's overtime, this was set to expire January 30th and was only paid weekends, but it should be every day and a minimum of 90 days at a time. I know I mentioned at the last commissioners meeting that the officer from the sheriff's department that I spoke to mentioned that everybody's forced to do overtime, and the environment is it's beyond fatiguing. They already have a very fatiguing and overwhelming job, and how it's gone for the last, almost 2 years, has really put a burden on our sheriffs that are there to keep us safe. So I mentioned at the last meeting, and Woodward's response was something to the effect of, well, we are working with them. I don't disagree with that, but instead of just working with the higher-ups, maybe we should get in there. So I'm going to backtrack for a second. I come from a place of, I owned a business for almost 20 years, and I had a really large staff. And the one thing I learned is that the team didn't care about how much I knew until they knew how much I cared. And it's important to go in there and find out what the sheriffs, what the people, the boots on the ground, what's going on with them, what's working and what's not working, and find out how we can best support them. Because if we don't have their support, we don't have the support that our community needs, especially, looking at things like what happened in Oxford. We need these sheriffs more than ever to feel strong, confident, and not fatigued, burned out, and done, right? So thank you.
Thank you. Is there anyone else from the public that would like to speak? All right, this public comment is closed. We move on to communications. There are two items under communications: the medical marijuana operation and oversight grant application exception, and the intake disposition report from December 2021.
Madam Chair, can I make a comment on one of the communication items before filing?
Of course.
In regards to item number A, which is the fiscal year 2022 medical marijuana operation and oversight grant application, this has now been a grant that here in Oakland County that I think we're on our third or fourth year. One of the things I know Commissioner Powell and myself have been working with the health department over the past few years in regards to this grant. And while I'm really happy that over the last few years we've placed a large emphasis on education and awareness, and as we move forward, we're definitely all about continuing to increase education awareness. But the one thing I did really make a point to emphasize on this year is taking a look at preventative measures of children accessing marijuana. And so it is my hope that as we move forward this year, that we really do place a large emphasis on getting lock boxes. There's been initiatives across our country, here in Michigan, with counties who also have applied for this grant, and they've placed a lot of their efforts on making sure that they're giving public the actual tools to make sure that marijuana is kept out of the reach of children and minors. So I just wanted to share that with the committee.
Thank you.
Thank you, Madam Chair.
Good idea. All right. Oh, Commissioner Ginzel?
I was just going to move to receive and file.
Perfect, thank you. Support, Commissioner Hoffman. All in favor say aye.
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 Opposed? All right, communications is received and filed. On to our regular agenda. The first item is about our Oakland County Blueprint for Successful Aging. And I know Commissioner Nelson wanted to speak to that.
Sure. Absolutely. Commissioners, as we all know, our population here in Oakland County is rapidly aging, and this trend is projected to continue well through 2045. And to embrace and prepare for these changes, the Healthy Aging Ad Hoc Committee was established last year. And in collaboration with AAA1B, the Healthy Aging Ad Hoc was tasked with creating an evidence-based blueprint for successful aging here in Oakland County. After a comprehensive community outreach, including town halls, surveys, and having discussions and getting feedback and suggestions from experts, industry experts, the Healthy Aging Ad Hoc, in collaboration with AAA1B, as I said, created a 36-page document that really highlights the top 10 recommendations for us moving forward with creating an age-friendly county. The point and purpose of this blueprint is to really take a look at those unmet needs, as well as looking at the gaps in services. And some of the recommendations focus on household repair, household chore programs, public transportation options, elder abuse prevention, assisting seniors with programs that provide in-home services, senior center programming and supports, as well as looking at how we can continue to reduce senior isolation and bring in and continue to work on embedding technology for our seniors, as well as looking at additional county programming. The purpose of me really bringing this forward to committee today is we need interested commissioners to help start moving some of these recommendations forward. The great news is that there are recommendations in this blueprint that won't necessarily require task forces or ad hoc committees. I think some of the recommendations, at least a few, could definitely be brought forward in a form of a resolution, whereas some of the other recommendations are going to take some time to take a look at how we can conquer meeting those unmet needs and also those gaps in services. So I encourage my colleagues on both sides of the aisle, if you are interested in taking lead on any of these recommendations, please let myself know. Reach out to our chief of staff and also reach out to Barbara Winter, who has been our guiding light with our senior issues and initiatives that we've taken over the past couple years. So,
Thank you.
Thank you,
and
Chair.
There are booklets, these booklets are available online or in the form that Commissioner Nelson has and available for your pickup here to distribute to your communities.
Absolutely. Thank you, Chair Loops. The other piece with that, too, is that we want to make sure, I know last month during our Senior Advisory Council meeting, I spoke on behalf of this blueprint, and our Senior Advisory Council reps for each of our districts are, chomping at the bits to get a hold of copies as well. So it is our goal to make sure that Senior Advisory Council reps across Oakland County have access to these. And I'll say it now just in case, but we have 600 actual tangible printed copies on hand. As Chair Lubes shared, we also have a digital copy, but if there is a need to look at producing more copies, that is something that we are able to do, but we are going to have to get a little heads up. So please just, as we work on delivering these and providing these out into our communities, if you are the last person grabbing a pile, let Joanne know, or myself, or again, Barbara Winter. So
Thank
thank
you.
you, Chair Lubes.
Commissioner Hoffman?
Thank you, Chair. I just want to welcome members of the Senior Advisory Council that are actually watching us today on YouTube, including my appointee, Linda Hyaduk.
Very
So
nice,
welcome.
thank you. Commissioner Ginzel?
Yeah, I'm actually happy to make a motion if we want to move this forward, and then I also have another comment, if possible, Madam Chair.
Yep.
Or unless you
No,
want
no.
to move it, I'll
Commissioner
support it
Nelson.
too.
Yeah.
Sure, I'll move it.
I'll support.
Okay, thank
Thank
you.
you.
Yes.
Yeah, so I just want to say that overall, I think this is good work. A number of years ago, we did a silver tsunami study of seniors, went out and surveyed them. A lot of the points here are not different. I think the difference would be the way that we fund these efforts and defining what the efforts actually are. And I think it is important that we try to work in a bipartisan way, because I think good intent around doing things individually sometimes puts you in a place where, from a financial perspective, it becomes unsustainable. And I know none of us want that. So I think, working through what do these things specifically mean, how do we fund them, and how do we ensure the funding's sustainable is going to be key, just like it was when we did the past study.
Thank you. And we have Katie Wendell joining us from Area Agency on Aging 1B. Is there anything you'd like to add, Katie?
No, I think we are just ready to support the commission's work, and we did a lot of community input sessions in creating the plan, but I know many of our community partners are really ready to roll up their sleeves and get more involved in making some of these recommendations come to life. So I think the community is ready to come together and get to work on these.
Thank you. Thank you. In a meeting yesterday, one of the comments from city staff was that they'd like to see social workers in the senior centers to assist the seniors with isolation and different activities. And I thought that was a good suggestion. Yep. Thank you. All right. Oh, Commissioner McGilvery.
Thank you, Madam Chair. I too, first of all, I want to congratulate Kristen. She did an outstanding job on the ad hoc committee as well as area aging. It's a full report, but my concern is this. With the silver tsunami one we did a few years ago, I didn't see a lot of action being taken on it. And to give you an example, I called just this morning to get somebody to shovel my snow, and the senior center told me that there's nobody available, that they're booked, and I might get it done in 10 to 12 days if I wanted it. So just an example. Seniors need help. We need to help provide that. That was the purpose of this report. So I would look forward to attaining some of those goals to help the seniors. So.
Thank you. So what we did in Clawson this year is somebody came up with the idea, somebody else was able to make them. So they're sticks about this size with a snowflake on top, painted green and blue. And for our seniors who are unable to shovel, we put them with a sledgehammer, honestly, into the ground. And any volunteer or resident goes around and shovels their sidewalks and driveway. And with the snow the last 2 days, each driveway and sidewalk has been shoveled for our residents. Commissioner Nelson?
Thank you, Chair. I just wanted to capitalize on two things that Commissioner McGilvery shared. I appreciate the shout out, Commissioner McGilvery, but I also have to say it was a team effort, and very, very impressed with the work that Commissioner Lubes as the Vice Chair, Commissioner Colwell, Commissioner McGilvery, and also Commissioner Moss. We definitely worked well together to get this through the finish line. So I definitely want to make sure I recognize our other members on the ad hoc, and also too, just to capitalize on what you said, Commissioner, housing repairs and housing chores were literally the top two really biggest need. And so it is hope that as we do begin, the housing repairs and the housing chore program are going to be placed at a higher priority right now. And additionally, Chair Loops, I absolutely love what you just shared. What a way to bring out volunteers within our community, and what an easy way to recognize those households that are unable to do that shoveling themselves. So I'd like to follow up with you after to learn a little bit more about that. Thank you.
Thank you. Any other comments? All right, roll call, please. Oh, prompt the vote. Okay.
Commissioner Nelson?
We have 8 yeas, 0 nays.
My motion carries. Thank you. All right, next item is extending temporary increase in the rate of overtime pay to reduce employee mandatory overtime hours. I have a motion by Commissioner Hoffman, support from Commissioner Ginzel. And we welcome you both to have any comments about this item.
Good morning.
Morning.
So we're here, I think, for the third time on this item. So originally, we did a pilot program for 8 weeks, and it was resoundingly successful. We went from 53 forces on the weekend down to 1. We came back to you to get it extended through the end of January, and now we're here to ask for an additional 8 weeks. So this is helping the problem on the weekend. But obviously, it's one kind of small part of the larger problem of, hiring, retaining, recruiting, that sort of thing. So we are working in all those areas and hoping that we can fill some vacancies going down the road and alleviate more of this. But we appreciate your support.
Commissioner Hoffman?
Thank you very much. How are we doing with increasing staffing, especially in the jail? That's a real problem, isn't it?
Yes, it is. It's a process. We actually, I believe, we had 4 people start this week, this Monday. They're going to start an academy in a couple of weeks. We're still moving along in the hiring process. We just had a meeting about the hiring process this morning to discuss how we can improve it. So we're going to look to take some steps there. I think we had 13 more applications, and I believe there's supposed to be at least 7 that we have that are starting in the academy February 14th.
Yes, 14th.
So
How many are we short still?
just in the jail, I want to say there's 38 openings, but don't quote me on that number, but it's somewhere around there.
Thank you.
But folks are also leaving too. So you get somebody that's a veteran employee that leaves, and then we replace it with a new person that's in multiple weeks of training. So it's just not stopping at this point.
Yeah.
So, I mean, obviously we want to see, and back in the day, we had 800 applicants for a handful of positions, and now, the numbers nationwide. We're competing with our neighbors, we're competing with other states, there's hiring bonuses, there's transfer bonuses, there's all kinds of stuff out in the nation that we're.
Thank you. Commissioner Nelson?
Thank you, Chair Loops. Kind of going off of what you just shared, what are we doing to attract? So is there anything that our Sheriff's Department is doing to set themselves aside? So hopefully we can get more candidates more interested in coming to Oakland County's Sheriff Department.
We have a recruiting sergeant that's starting soon. I know the position was approved, but that person's been off work for a little bit. I think they're coming back this week. We are attending any job fairs that we can, where we set up stations, advertising where we can. So we're doing our best to recruit where we can.
We do have a hiring bonus right now. It's not large. It's not, some agencies I've seen are like $25,000. We're not that high. We're in the $3,500 range. So we have that. There's a county bounty. So if you know anybody and you refer anybody, then there's also a bounty for that. We partnered recently with Michigan Works. that was really interesting where they put this whole campaign together and said, hey, you know what, you could be the next dispatcher, you could be the next corrections deputy. They did flyers, they had online Zoom meetings where people could sign up, because obviously if people are going into Michigan Works, they're actually looking for employment, and they might not know that these are career paths that are available to them. So that's been really interesting. So we're hoping that we can expand on that. We're open to options.
Sure.
Towards the end of last year, we actually ran the physical test that's required to apply, so we tried to get some people in that took the test and have them apply right away. So we're
Oh, excellent.
trying to explore all the options.
Excellent. Thank you.
Commissioner Jackson?
Thank you. Okay, television program, Law and Order. Okay, we know that your deputies are an integral part of the whole criminal justice system and process. How are these shortages affecting cases? Because, you know, Oxford funding came before us at our last full board meeting, and the need for additional personnel, investigators, officers, and we also kind of got word that an ask would be coming from the deputy's office, sheriff's office as well. But how does this shortfall affect people who are awaiting trials and the whole system itself? We know how it's affecting the jail and how it's affecting your officers' morale and work life. But as far as just the criminal justice system, and court cases,
We're putting in the hours necessary. To my knowledge, the court cases have not been affected by anything we've done or not done. Any delays, and I'm not blaming the courts, but, you know, COVID with the attorneys, as far as I know, there's been no delays in any court cases on our part.
as far as the sheriff's
As far as-
end of this, like, you know, shortfalls or anything. And the reason why I asked was because I did hear from a judge that was speaking to me about the backlog in court cases because of COVID, as you mentioned, and Zoom proceedings and lack of being able to assemble juries. So I just wondered if the sheriff's office had, you know, concerns as well.
We're putting in the overtime hours to try and make up for any downfall, so,
Okay, and I hope that we will continue to support you guys.
thank
We
you.
appreciate it.
Commissioner Gingell?
Thank you, Madam Chair. I guess I would just urge on the recruiting front, I know you said you have a sergeant or a coming back. I mean, let's take a look at what's going on in the private sector. Let's try to be creative. If you look at Suburban Automotive, they're running TV ads about showing Suburban, here's why it's different, unique, why, something that could be done with the sheriff, maybe radio, things of that nature that's out of the box, that maybe mirrors what the private sector's doing. Because to me, like, we need to build, and I'm not getting into any HR item, but if you look at the age segmentation of our deputies, from my observation, this isn't a short-term issue and fix. This is something that's gonna have to be addressed over the next 5 to 10 years. We're gonna have to have this continual base coming in to replace those that are going out. And, you know, I think we need to be thinking about it differently, and we may need to make some short-term investments in recruiting as a board to be able to get more exposure and create the demand, or I guess the demand, in a way that we're competing for it, right? So let's be aggressive. We need law and order, and we need the sheriff's deputies
Yes, sir.
filled.
Okay.
We're open to any of it, and obviously part of it is public perception too. This is not a profession that I think people are clamoring to be in at this point in time with things that have gone on publicly. So,
Sure.
you know, we
Understood.
have a number of challenges besides just the labor shortage as well. So,
Yeah.
but yeah, any opportunity or any option that we can, you know, get the word out that this is a great place to work, we're happy to do it. And then to your point, I think the East Annex opened in 1988. So there was a large hiring pool at that point in time. And you add 25, 30 years to that,
Right.
that was we had a huge retirement chunk. Then we hit a pandemic. Then we have a VSIP, early, you know, separation in the middle of that. So that's kind of, you know, contributed to the even larger shortage and the continual hiring issues
Right.
that we have. But it's not for lack of
And you got
trying.
about another 5 to 10 years of that run probably too,
Right.
right?
Yeah, because not everybody stays 44 years like the undersheriff,
Right.
but the former undersheriff.
Yes,
Anyway.
thank you.
Commissioner Jackson? Just to piggyback on that question, because Gail, you did mention it even before Commissioner Gingell brought it back up. What is the percentage of experienced officers that is expected to retire over the next few years?
percentage, we'll have to get
Yeah, I
back,
don't
because
think we looked at that recently. We tried to avoid, we don't want to know.
Right.
I mean, we could probably tell you the percentage, but obviously it depends on everybody's personal, we can tell you maybe aging
Based on
or.
age, maybe. Like you said, everybody doesn't stay over 40 years, but maybe folks that have been here 30 years.
Yeah.
And
Oh,
that's-
yeah.
It might be interesting to see a bell curve by longevity or tenure. We don't need names, we don't need individuals. You just need the bell curve, longevity and quantity.
We'll take a look at
That'll
that.
tell the story.
Yeah, and
I'd like
we-
to think we've gotten a little bit younger because of all the vacancies. We've had a lot of hiring, not as much as we needed, but
Would just be good to see it. I
yeah.
think.
Yeah, the potential. So I mean, I know we have something, we'll have to pull it up for you. I don't have it off the top of my head, but the potential of, hey, here's the people with 25 years and more. What we're seeing right now, though, with some of the people that are leaving, they might have 20 to 22 years or something. They're veteran employees that are just like, you know what, I can't work another shift and I got to go, which is really, really unfortunate, because that's probably our biggest hit right now, is losing experienced people.
Commissioner Cavell?
Thank you, Chair Lewis. Also, I'm checking in. Sorry for being late. Do I have to do something else other than?
You're fine.
Cool. I was curious. So this is for another 8 weeks. Then you're going to come back in 8 weeks and ask for it again, probably, right?
I'm sure we'll have that discussion, unless somebody wants to propose something longer or something, something more solid, so we don't have to keep coming back every time, because obviously we have a lot of other competing
Right.
priorities we'd like to focus on instead of
Right.
redoing the same thing over and over if you guys are in support of it.
Well, yeah, so to that, you've been using, you said before, your favorability to help pay for this, right?
Yes, that's where Fiscal Services has identified where the funding was coming from. Our favorability from last year fell to fund balance. So really, it's fund balance. It fell to fund balance, and then they're using that.
Okay. So is the, so there's an appetite, say, to come back in 8 weeks with a 6-month proposal so that this can be something that's more solid that the deputies can count on? Is that,
I would appreciate that.
okay. And that would come from fund balance, or that would come from?
I mean,
like,
that'd be a
fund-
discussion with Fiscal Services, because obviously they identified the funding source, but
Okay.
I'm,
Okay,
or county exec admin.
yeah.
So.
Thank you.
Commissioner Ginzel?
Yeah, so I was just going to pick up on Commissioner Cavell's point, and maybe what we could do as a committee through the chair is ask that you have a discussion with the chair of the board, and we could adopt this today here in committee, and we can modify it and amend it at the board if we want to extend it at the board meeting. It seems reasonable to me if there's a path for funding, because if you say 8 weeks, essentially 2 months, and if Omicron peaks in the middle of February, runs backwards, you're going to be dealing with that for beyond 8 weeks. So maybe we could handle it that way if it's satisfactory to you, Madam
At
Chair.
minimum, we could do 12 weeks right now.
Yeah.
Give
So
them a buffer.
maybe a conversation outside of this meeting, this passes it, keeps it going, we can amend it at the board if the committee or the majority chooses to do so.
Okay. Yep.
If I may add along those
Sure.
lines, that would be appreciated, because even if we were to hire all 40 vacancies today, there's weeks before they're trained and ready to go.
Right.
So we have a 7-week academy and then at least 7 weeks of training before they're on their own. And that's at a minimum.
Yeah. Okay. So do we want to move forward with this item as is or amend it now?
As is. I think as is good.
Say it again?
I was going to say, I like what Commissioner Ginzel said, as is, and then talk to the chair, make sure the numbers even out, and then do the 12 weeks or longer
All right.
before the board.
Well, rest assured, we'll amend it. All right, any other comments? Roll call, please. Oh, prompt to vote.
Howell?
Can I abstain, because I don't even know what item we're on?
No problem.
Thank you. Oh, it's probably was a yes, wasn't it?
Overtime sheet.
It's
Oh,
overtime
yes. Oh,
extending
no,
it
I need
for
a
the-
yes for that. No. I do not want to be a commissioner messing with sheriff's overtime, no. Thank you. Thank you, Janet. No, I don't want to be on record on that.
We have 9 yeas, 0 nays.
All right, motion carries. Thank you. Our next item, also from the Sheriff's Office, a grant application with the Michigan Department of Treasury for the fiscal year 2022 First Responder Training and Recruitment. And so this conversation just continues. I have a motion by Commissioner McGilvery, support from Commissioner Cavell. Is there anything you'd like to add about this item?
Basically, just a little background. So I'm not sure. I know Commissioner Cavell has seen this simulator. I'm not sure if anybody else has taken the opportunity. It's really, really an interesting tool in our training group. So this really came in handy during the pandemic because obviously we had to shift training. We couldn't have as many, as large a training classes as we had, so they had to pare those down. This was actually a tool that they could use more so to train individually or in small groups, and they were able to socially distance. This is something that we were going to think about anyway, is upgrading this technology. And I think we've talked about it in certain terms, like maybe at some point we can get another machine because it is so useful. And anyway, this grant opportunity came up, and we got a quote, and we're hoping that we get the funding so we can upgrade this really useful training tool.
It is a good tool. Years ago, as mayors, we went to various cities to learn about what was working for them. And Farmington Hills had training like this. It was very realistic. You were involved in the scenario, so instantly you have to make a decision about good guy, bad guy, or what you're going to do in this situation. But very real life.
I think that's what's interesting about it, is to think, if you haven't been in that scenario, to think about there's so many different factors and there's so many different people and what you have to think about and what you have to decide in a split second. It's very, very interesting.
Yes. Any other comments or questions? Roll call, please. Prompt the vote.
Yes, for Commissioner Powell.
Thank you. We have 9 yeas, 0 nays.
All right, motion carries. Our next item is a budget amendment appropriating funding for a contract with WellPath to provide medical services at the jail. I have a motion by Commissioner Gingell, support from Commissioner McGilvery. Anything to add?
Well, asking for your approval for this. Obviously, we've used WellPath, formerly Correct Care Solutions, for a number of years to provide medical care inside the jail. As far as I'm concerned, they've done a very good job. I was on a part of the bid process for this RFP. They were the clear winner, and we are hoping and asking for your support on this.
Thank you. Any comments or questions? Commissioner Hoffman?
I just have a question. It says that the contract will increase by $2,238,000 over 3 years. How much is the contract before this increase?
So our current budget is $5.98 million is what we have in the current year. So just if I could give you a little bit of background on it. So we for about 8 years, they were pretty consistent with 3% increases across the board. That's what we had each year. I think when we were here in October, we came to talk to you about the RFP process, and we anticipated some significant increases, because mostly due to staffing, because obviously there is a medical and especially nursing shortage nationwide. So we're competing with all of that, trying to recruit, retain, hire just like the rest of the nation. We anticipated that. We've also had a lot of increases in pharmaceuticals. So we did a detailed dive into from 2017 to 2021 based on the needs of our inmates. Some of our pharmaceuticals increased 45%. So the large increase in this first year is mostly 7% of that is on staffing to maintain the workforce that we need to have to fill this contract, and then the rest is in pharmaceuticals. So we actually, obviously we knew that they were going to have to make a lot of changes, because we had this consistent inmate population for, like I said, about 8 years that we've contracted with them, and then in 2020, the bottom fell out. You would think that the lower inmate population would have equated to lower cost, but that wasn't necessarily true. The complexity of some of the cases, and obviously all the COVID testing, COVID protocols, quarantines, a lot of stuff changed, and being able to hire people and get them to work in this type of facility has been challenging as well. So like the undersheriff said, we've been very happy with the contract with WellPath. We have some very dedicated employees, and in fact, some of them used to be county employees. So I think we're probably a little bit unique maybe with other contracted agencies because they were county employees, and so at heart, they're still dedicated to our team.
Okay.
We actually asked them, because we haven't been in this situation, we asked them to give us 3 different scenarios based on population size, because we weren't sure, and we don't know if we're ever going to get back to the 1,200, 1,300 that we had. Our max population is 1,664. We know that's probably not likely, so we settled on a number in the middle, and then we went with that. So they also have a pricing guarantee built into their contract. So if they go over budget, we get 50 cents back on every dollar up to $120,000. I'm not aware that that's happened at any point in time in this contract. So there is a really good partnership on containing costs, and the last several years, the 3% increases, we've been able to absorb those in our budget. But obviously this large of an increase with this new contract, we had to come back to you to ask for additional funding.
Yeah, that's a big increase.
Yes.
Thank you. Commissioner Nelson?
Thank you, Chair Lubes. I think you kind of touched on this a little bit, but I'm uncertain. What exactly does this additional funding go for? Like, what are we spending this additional money on? Is it staff? Is it medical services? How will this money be utilized?
Yeah, 7% of the increase is going to staffing. So
Is it present staffing or bringing in more staff?
present staffing.
Present staffing.
Yes.
And what does that include? Is that nurses, psychiatrists?
It is a little bit of everything, because they have dental, so we have a health services administrator, medical director, PAs, director of nursing, RNs, LPNs, medical records clerk, CNA student, administrative assistant, dental director, and dental assistant. So there's quite a range of the services that they provide, from medical to dental to.
Sure. Thank you for that clarification. And just lastly, so from what I understand, all inmates who come in within that 14 days of intake, they're given a health assessment. It sounds like it's a comprehensive health assessment that includes not only just your physical assessing, but it also looks like a mental health assessment and psychiatric screenings. Are those assessments, are they simple checklists, or are they actually an evidence-based assessment utilized to assess the mental and psychiatric health of an individual at that time?
I honestly don't know. I'd have to
I can
consult
respect
them to
that.
find
Yep.
out.
Let's definitely
if it's a
follow up
checklist
on
or
that.
not. I will find out.
Excellent, thank you. And then with the 7% going to staffing and needs, do you foresee that this will impact the amount of time an inmate upon intake will receive these health services, or I'm sorry, the health assessment? So right now it's a 14-day window, which I think is a pretty long time for an individual upon intake coming in, right? Do you think that this additional funding for staff is going to help reduce that time frame for individuals coming in at intake?
Let me, the 14-day window, let me just clarify, is I know that's what we use for quarantine, and that's kind of the target, but in my discussions with the Health Services Administrator, Vicki Warren, I think we see everybody within 8 days, if I'm not mistaken.
Okay, I appreciate the clarification, because in the document, it says 10 to 14 days with the goal of trying to get down to 10.
Yeah,
I don't think it was COVID-related. I think it was just from an intake health assessment. So I'd like to get some clarification just on that, because like I said, even 8 days, right? So 8 to 14 days is what we're dealing with. I think that's an extremely long time for an individual to go without having that assessment done, especially for those individuals who do come in with additional mental health concerns and psychiatric pre-existing potential conditions.
Yeah, so if there are any immediate concerns that's noticed by anybody, they're seen a lot quicker. That I do know. They'll call a nurse down right away if there's something that's medically questionable. But yeah, at the 14 days, 10 to 14 is the target. I'm pretty sure they have their physicals within 8 days.
That is it.
And
Thank you.
just one more note on that. I think we've talked about the MAP program before, the medically assisted treatment program. In this bid, we asked them to expand that. So that's part of the intake, and we're not sure, because we had partnered with OCHN for Oakland County residents to take care of that. And in this proposal, they've added that. So that's also part of the cost increase, that they need to take that on. So at intake, they would look at that. And then if anybody, because obviously we can't afford to have anybody go into detox. So, and that would be an immediate need. So that's one thing that's also a change in here. And then if I could, so I don't know if you remember in October when we talked about this, Chairman Woodward had asked about, have we considered looking at this in-house again? Because obviously years ago, back in 2012, I think is when we transitioned to contracting. So I did some research, I went back and looked, and in comparison, so that 6.5 million in year one seems like a large amount, and it's a large increase from what we have. Our 2010 actuals for the jail clinic that we actually paid 12 years ago internally was 6.1 million. So when you think about it in terms of that 12 years later with this large increase, I think that puts it a little bit more in perspective of having in-house to this contracted service.
Thank you. Thank you.
Thank you. Commissioner Cavell?
Yeah, thank you for bringing that up, Gay. I was going to ask about that because also in 2010, there were more inmates in the jail, right? Which meant likely more services being done. And I understand that the cost difference is $400,000 less, but then you add that it's been a decade, so cost increases and then the 7% increase. So understood that it might not be cheaper, but that's not the only metric we need to use. One thing is, for those of us in finance who've interacted with WellPath before, I at least have had a bad interaction with them, so I don't like WellPath, and I don't like the fact that this will be their like third or fourth 3-year renewal, right? Or this will be like their 11th.
Third, I think it's our third time to bed.
I don't like that either. So I won't be voting in favor of this. I understand that there's the time crunch and that, COVID, so you got to keep things going. So I understand the position you're in, but I don't like it.
Commissioner Jackson?
Just a quick question, because I didn't see any statistics on how many incarcerated persons are receiving health care from the clinic. And how many prisoners have private health care? Maybe had employers that they're still employed with, even though they're incarcerated? I mean, all the prisoners don't use this healthcare system for all their ailments, right? Am I correct with that?
My understanding is they will follow up. I don't know if they use their health care, if they can get that information, if they report it to us, or if we can figure it out. I do know they will utilize Medicare and Medicaid where they can. They check that in the system. So I'm not certain. I know everyone is seen by the clinic at some point because it's part of the physical at intake. Whether or not they use the services later if they get sick, that would be up to them submitting a medical request. But I wouldn't be able to, right off the top of my head, give you a percentage of how many where we use their health care if they had it and how many use ours.
And there's a reason why I asked. I had a company to approach me once they audit jails across the state and other counties, and they do find that we could get reimbursed by other healthcare providers for incarcerated persons that are using our in-house health systems, but that those audits don't occur. Like you said, Undersheriff, that you don't know what people report, but there are agencies that can look into this and maybe help us with some of these costs. So I wanted to bring it to your attention. Maybe somebody from the jail could come before us and maybe report on that, because I'm sure they've been approached.
So we can definitely look into that. So I know when we did it in-house, we actually had a person that did that and looked, and that was one of the, as they were looking to kind of, hey, how do we contain the cost for this, is the sheriff's office dedicated a position to actually look at other funding sources, look at outside before the county took on that cost to see where we could maybe charge some of those other costs. So I will verify that that is still taking place or not taking place with WellPath.
Thank you.
Thank Commissioner Nelson.
Sorry. Last question, just to capitalize Commissioner Cavell in regards to WellPath. It looks like, from my understanding within the documents, the request for proposal was placed last year. Yes. And WellPath was the only bidder who included and this is where I'm going to highlight, a complete health program for the jail.
Yes.
Does that mean that there were other bidders who sought out a request for this proposal? But it sounds like the word complete. Was it a matter of what would be an incomplete submission?
They did not give us any proposal for pharmaceuticals, which, as you know, is a huge, huge portion. So you can't award a bid to somebody that didn't provide that, because obviously at this point we don't have the capacity to do that on our own. This is a turnkey solution. So
Thank you.
Yep.
That's it. Thank you, Madam Chair.
All right, anything else? I'll prompt the vote, please.
Commissioner Nelson,
Oh, I submitted.
you hit save. Oh, there it goes. Okay. We have 8 yeas, 1 nay.
All right, motion carries. Thank you.
Thank you.
All right, next item is with the Michigan State Police Community Service Division for fiscal year 2022 coronavirus emergency supplemental funding. I have a motion by Commissioner Gingell, support from Commissioner Nelson. Let's see. Oh, I'm sorry, I could have looked up for video. It was checking out, so we have John Cooper Ryder here to address this item. Thank you.
Yes, sure. Good morning, Commissioners. My name is John Cooper. I'm the business manager for the Circuit and Probate Courts. Also here with me today is Christina Bujak, who is our Chief of Court Business Operations. We're here to accept $50,000 in grant funds from the Michigan State Police and Grants and Community Service Division with the U.S. Department of Justice for the grant period of January 1st through December 31st of 22. The funds are going to be used to purchase an evidence presentation system to assist in jury trials. It will provide a better way for case parties and court staff to present exhibits, share files with jurors, and to sign documents. We're working on putting together a scope of service right now, and we'll be working with purchasing to submit a formal request for proposal shortly after this grant is approved by the U Board of Commissioners. So I'm here to answer any other questions. Chris is here to answer any other questions that you may have in regards to this item.
Thank you. Are there any questions or comments? All right, good job explaining. Prompt the vote, please.
Oh. We have 8 yeas, 0 nays.
All right, motion carries. Thank you.
Thank you very much.
Our next item is from Emergency Management and Homeland Security, a grant acceptance and approval of an interlocal agreement with Macomb County for the 2020 Homeland Security Grant Program. A motion by Commissioner Hoffman, support from Commissioner Nelson, and we have Robert Seeley here to address this.
Well, good morning, Commissioners. This is Rob Seeley, Chief of Emergency Management for Oakland County. What we have today is our Homeland Security Grant Program, which has been an annual grant program since 2006. This is administered by the state of Michigan. It's FEMA funds that's passed through the Urban Area Strategic Initiative, or UASI group, which Macomb County is our fiduciary. They then divide it among the 7 members, and then we get a portion of that money that was passed down. Our portion this year is $536,333, which is the UASI funding amount. Along with that comes $39,376, which is another Homeland Security fund that's in that same arena. And then another $200,000 comes to pay for the 2 people that we have that are hired that the sheriff's office administers that do information from the state of Michigan. They're in our fusion center in Detroit. And then there are 2 staff here that are both solution area planners. So that's what that fund pays for. The $536,000 goes through our grant allocation process, through our GAC committee or grant allocation committee, and they meet monthly to decide where that gets spent to improve the overall resiliency of Oakland County.
Thank you. Any comments or questions? Commissioner Cavell?
Thank you, Chair. Hi, Robert.
Hello.
If I remember right from what Tom Hardesty has said before, the Homeland Security Department is like 9 full-time staff, but it's able to, hey, Tom, we were just talking about you. So the department is 9 people, but then it expands and contracts as needed based on like emergencies, right? But there's 9 core staff, right?
Yes.
And so this funds 2 of those 9.
This funds 2 of those, a portion of 2 of those that are solution area planners. They're the 2 people here that take that grant money. They're the ones who do all the paperwork for the state and for the county of Macomb. So that way, when we decide on projects, they're the ones who actually put the projects in motion.
Okay, and then it funds 2 staff housed in the sheriff's office that you said work in Detroit.
Well, they work at the DSEMIC, the Detroit Strategic Information Initiative in Detroit. The DSEMIC is an intelligence gathering organization that is made up of the UASC region, the 7 of us. We also have a fusion center that's housed at Michigan State Police that they work in concert together. Each one of the areas of the UASC region, each one of those 7 members are able to give a member to that DSEMIC. We have 2 currently. We were given 1 of those positions from St. Clair County a year ago, and that went into last year's grant proposal. So we now have 2 people that we pay out of that money that work at the DSEMIC.
Okay, can you just send me information about this DSEMIC? Because I don't know what that is, but I'd love to learn more and don't want to take up the
Yeah, we can do that. That's not a problem.
Any other questions? Prompt the vote, please.
We have 9 yeas, 0 nays.
Thank you. Motion carries.
Thank you, Commissioners.
Thank you. Our next item is another grant application with the Federal Emergency Management Agency to the Building Resilient Infrastructure and Communities Grant. I have a motion by Commissioner McGilvery, support from Commissioner Nelson. So welcome back, Tom.
Good morning, Commissioners. Thank you. This is actually the first of 2 grant applications in front of you, and they're both for the exact same project. As you know, the board approved earlier this year a feasibility study, part of which includes a EOC, a 911 center. So these applications, we're trying to seek federal funds through FEMA to help pay for a portion of the design of that. There is potential that one of these grants could pay for the cost of design that is the difference between building a regular building and building a hardened facility. So there's pretty strict guidelines of what FEMA might approve it for. Part of the reason for such the late period of getting this in, this has to go to the state first. And at first the state told us to apply for the BRIC grant. And then they said, well, no, let's do it with the other hazard mitigation program. And then they said, well, no, let's do it to both. And then we'll see which one we can get. So that's the reason you have 2 of those in front of you. The total cost of the project is $580,000. 25% of that, or $145,000, would be a county match. That would come from funds that have been already allocated to this project for the feasibility study. So it's not requesting further funds with that. So actually, in the end, we would hope to actually save and not spend the $450,000 or so out of the general fund.
Thank you. Questions? Commissioner Cavell?
Hi, Tom. So the $580,000 is the difference between a non-hardened facility and a hardened facility planning?
That's all the planning, architecture work. You know, there's 3 or 4 stages to that: pre-design, design, construction documents, all of those things. But correct. They figure that's about somewhere in the neighborhood of 22 to 25% of a project is the increased cost to do a hardened facility.
So then a hardened EOC 911 dispatch center would cost 4 times 580,000-ish.
To design. These are just
okay.
in design, yes, sir. Not to build.
Okay. Thank you. Oh, well, wait, one more question if you don't mind. So then we've already spent the $1.49 or $94 million on the planning.
No, we had not spent all that. These are estimates. So that's not all been spent. There were funds, engineering I know handled it, but there were funds approved to do the feasibility. They've not all been spent. As a matter of fact, most of it has not been spent.
And this would help defray some of that cost?
Correct.
Okay, thank you.
Thank you. Anyone else? Prompt the vote, please.
Tracy, I vote yes. My page left me.
Uh-oh, okay. Thank you.
I'm sure it's operator error.
It always is with you, Bob.
We have 9 yeas, 0 nays.
Motion carries. Thank you. Our last scheduled item is also with the Federal Emergency Management Agency for the Hazard Mitigation Grant for DR 4494, Michigan. As Mr. Hardesty explained, a similar item. I have a motion from Commissioner Hoffman, support from Commissioner Powell.
Thank you, Commissioners. As I mentioned, really same information as last one. This would just be a different bucket from FEMA. So whenever there's a national disaster declared in a state, the following year, some funds generally become available. So because in 2021, the 4494 of this program actually relates back to the pandemic. So it's made some hazard mitigation money available. And I know it sounds funny that we're using something from a pandemic that doesn't go towards a pandemic, but this is where the state recommended we apply here kind of as a backup to the BRIC program. If we don't get it from the BRIC, that we may get it from this program. So the same information as last time as far as cost and where that would go.
Thank you. Comments or questions? Prompt the vote, please.
Hoffman is a yes. We have 9 yeas, 0 nays.
All right, motion carries.
Thank you, Commissioners.
Thank you. Our next item is public comment. Is there anyone from the public wishing to address this committee today?
Tasha Shergan from Clarkston. The December 9th public safety meeting was inserted last minute for 4:45 for all sheriff contracts. Shamefully, the parks contract was only extended for 90 days. The excuse given since Mr. Chris Ward changed from working on the Board of Commissioners to being appointed as Director of Parks and Rec. This director-level position was just created to replace the management merit position, which means another county employee lost an opportunity as a result of this change. Thank you.
All right, anyone else for public comment?
Hi, Beth Felix from Clarkston. I just have a question. Well, I guess you can't answer questions. A statement, and wondering why our health department isn't being questioned a little bit more on these mandates that are coming down. This is a memo, again, sent to Oxford schools. The OCHD recommends that any completely vaccinated individual does not need to quarantine. They may remain in school and monitor symptoms for 10 days. Individuals who are not fully vaccinated or have not received any vaccines for COVID should quarantine for 5 days. So you tell me, your sick child can go to school, they've been vaccinated, and they can infect my child. That makes no sense in who is making these decisions. I suggest that we get in touch with Leanne Stafford and really put her to the test.
Thank you. Anyone else for public comment? All right, public comment is closed. There is no other business to come before this committee, so at 11:59, this committee is adjourned. Thank you.